Mr Deputy Speaker, and my honourable friend from Blakely and Broughton queried whether Manchester had been discriminated against because in London ministers considered a threatened 500,000 job loss and put it in Tier 2. He seemed to be suggesting London should have been in a higher tier. I disagree. Frankly, Manchester and the Midlands should have had the London criteria applied to them, taking account not only of medical evidence, but also the risk to the economy and jobs and society. And let us also not set up a false dichotomy between health and economic factors. We already do this. The National Institute for Health and Care Excellence, evaluates new treatments. It puts a value on those for each quality-adjusted life year, somewhere between £20,000 and £30,000 a year. We have seen no such analysis done with regard to the pandemic or suggested remedies. The member for Windsor said that if we haven't had a proper impact assessment. Absolutely right. Yesterday we had a slightly odd and fairly insubstantial document produced by the government. It doesn't really fit the bill. There must be some more rigorous analysis lurking somewhere in Whitehall. However, there were some nuggets in there. They referred to what they termed economic scarring, deferred or cancelled investment in physical capital and lower innovation, destruction of valuable firm-specific capital and knowledge due to business failures, the loss of human capital due to sustained unemployment and changes to business models away from contact-intensive services, early retirement prompted by the pandemic, increased loss of days worked due to sick leave. And behind all those phrases are real human tragedies. And we also ought to be quite clear that the vaccine, while it is a huge breakthrough and enormously welcome, is important, it's a great advance, but it's not a panacea, and certainly not for a long time. And saying that we must vote for this tonight because the vaccine is just around the corner is, quite frankly, the manana option, and I do not think should be actually given serious consideration. We've got to actually move from risk avoidance, which seems to be the mark of this government, actually to risk management. And what we really need is a targeted approach based on robust evidence that the measures that need to be put in, frankly, are not these ones tonight. The case has not been made for them, and that is why I will be voting against this measure tonight.
Lillian Greenwood.
Thank you, Mr Deputy Speaker. My constituents have, with very few exceptions, done what was asked of them. They've made immense sacrifices, playing their part in getting infection rates down to protect our community and our hospitals. But they feel that the government has not done its bit. It hasn't used the lockdown to fix, test and trace. We know that public health teams can do better. Please, Minister, give them the resources to deliver. The government also hasn't ensured that when people are told to self-isolate, they can afford to do so. Ministers must extend eligibility for the £500 support payment to users of the NHS COVID app and look again at the level of statutory sick pay. And government hasn't done enough to support businesses and their workers, especially those that still can't reopen under the new Tier 3. It can't be right or fair that Tier 3 areas get the same support as those in Tiers 1 and 2, or that some self-employed workers and small businesses are still excluded from support altogether. Now, our cafes and restaurants, and especially our pubs, are suffering. Despite all of their investment in COVID-safe measures, they remain closed at what would normally be their busiest time of year. The government must step up and give them the help they need, or I fear they simply won't reopen at all, and some places will lose their vital community facilities. My constituents are deeply disappointed that Nottingham, despite a huge fall in cases, remains in Tier 3. But what they want to know is, what do we need to achieve to come out of Tier 3 when it's reviewed on the 16th of December? People need to feel that the allocations are fair, and they don't, and they need clarity about what we're aiming for rather than constantly moving the goalposts. We also need clarity about the restrictions themselves and the evidence on which they're based. Nottingham's home to the National Ice Centre. Our city is famous for its past Olympic champions, but it's also the training ground for the gold medalists of the future. Why are ice rinks classed as leisure and entertainment venues and forced to remain closed when other indoor sports facilities are allowed to reopen? And what about 10-pin bowling? The sector doesn't qualify for 5% VAT because HMRC say that a bowling alley is a sports facility, but unlike gyms and leisure centres, it isn't allowed to, permitted to open either. Bowling alleys, like other places, have invested in measures to ensure their venues are COVID secure, and they aren't the only ones. Nottingham Playhouse has spent £80,000 implementing measures to secure See It Safely status. The team has worked really hard to give Nottingham families their traditional panto trip, but now they're closed, even though not a single case of COVID in the old Tier 3 originated in a theatre. So please, will the Minister rethink that restriction?
Tobias Elwood.
Thank you very much, Mr Deputy Speaker. I think I learned from you, Mr Deputy Speaker, don't let the fact that something's been said in a debate prevent you from saying it again. But the fact that something has been said again and again and again today, I hope the front bench is listening. Yes, we want that transition from lockdown to the tier system, but it must come under proper scrutiny. It's so important that we have to be honest with the people. But also, let's be honest about this place. Most people don't see what goes on here. Votes take place all the time. But the vote that takes place today will affect every citizen, every family, every business. And it's so important that the oversight that Parliament provides is allowed to do its duty. And that has not taken place this time. We are facing challenging events, there's no doubt about it. What governments all across the world are looking at is this balance between lives and livelihoods. The COVID-19 pandemic, containing that, but also supporting the economy. I'd add a third element to that, and that's the will of the people, the consent, the buy-in of the nation to want to follow the rules. And I am worried that this government might be losing that consent if it doesn't work with the country and with Parliament in a stronger way. Communities want to understand why they're in a particular tier. They want to understand what they need to do on the 16th of December to actually move to a new tier. And that was not forthcoming, certainly not in the documentation that was provided very late in the day yesterday. In Dorset, we went into lockdown with very low numbers. We came out of it with even lower numbers. The last 2 weeks of data, the numbers fell by 1/3, and yet we end up in Tier 2. Dorset hospitals are, yes, our numbers of COVID have gone up a little bit, but we have empty Nightingales across the country. And this argument say they can't be staffed. I've checked with the MOD. There are 2,000 medical personnel ready to be mackered up if we request them to do so. Let's not use that as a factor to hold us against and push places like Dorset into Tier 2 unnecessarily. And then I say this very carefully, but it's something I've been stressed from the beginning. We have a peacetime government construct, a cabinet system which works well, it's tried and tested. But we should have moved to a war footing. Number 10 is overwhelmed. The bandwidth cannot cope with everything that's going on. You've got COVID-19, you've got the economic intervention, you've got Brexit, the integrated review, preparing for COP26, and then you've got the G7 presidency as well. It's the same people who are not, I'm afraid, these are friends of mine, but they are not trained in crisis management, in strategic planning, or indeed in emergency response. All the more reason why this place needs to do its job. And let me be the first to say, and I say this very cautiously, I do believe we need to reconsider this 5-day opening up over Christmas if we want to take advantage of the gains, the hard-fought gains that we've developed over this year. Thank you.
Toby Perkins.
Thank you very much, Mr Deputy Speaker. I think the weight of opinion that has been heard today should be making the government think twice about the direction they're taking. I think the fact that the Prime Minister had to come here today armed with an assurance that the thing we're voting on today is going to be changed in a couple of weeks should tell him that he's got it wrong. And I think that the fact that members of Parliament are being asked to choose either between following exactly the approach that the government take or having no restrictions at all is the height of irresponsibility. And we've heard from a number of members opposite that they can't support the particular approach that the government is taking, but that they're not advocating an approach of no restrictions at all. Now, in Chesterfield, as I said to the Prime Minister earlier, our rate is now down to 118 cases per 100,000. The rate in London is considerably higher than that. in many areas. We're told that the Prime Minister intervened to prevent London going into Tier 3 because he didn't want the economic cost, but he was happy for that economic cost to be paid by the restaurateurs, the pub owners, the cafe owners and all those workers whose jobs are jeopardised by this approach. I don't believe that the government's approach on tiers is joined up. I don't believe it enjoys public confidence. I don't believe that the public think that it's fair. I don't believe that the public believe that the tier system is being done on the basis purely of the medical evidence, but that it is being done on the basis of the government wanting to keep London in a different tier. And in terms of Tier 2, it's all focused on the hospitality sector, when there's so little evidence that the hospitality sector is the cause of the major outbreaks. There's been too little strategy on testing and tracing in terms of schools. We've seen care homes, we've seen hospitals, we've seen workplaces, all without a strategic joined-up approach. Just today, when the leader of the Liberal Democrats asked whether people who were being told that they were going to be able to stay with elderly relatives over Christmas, if they wanted a test, could they get one? Well, only if they had symptoms should they get one. So we haven't got a testing regime that's fit for purpose. We've got a tier system that doesn't enjoy public confidence. The support package for the hospitality sector is edging up day by day. There's another £1,000 here. It's inadequate in the context of the losses that the hospitality sector are going to face over the Christmas period, but it's changing the whole time, which is an absolute recognition that the government realise that they haven't got it right. And what about all those other businesses who aren't closed but support the hospitality sector, like those food service companies who supply into hotels and restaurants, like those drinks providers who supply into pubs? There's a whole array of different businesses that are jeopardised by this approach, and that's why I won't be supporting the government's approach tonight.
Edward Lee.
Mr Deputy Speaker, on a lighter note and a deeply serious debate, my wife had to come in for a bit of House of Commons work today, and we sat down at the same table. We were immediately told by a member of your staff and the Deputy Speaker to sit at separate tables. It seems in COVID Britain you can sleep with a woman for 37 years, but you can't have lunch with her. and this raises a more serious point, that we don't want to return to the controls of wartime Britain. People romanticise it, but there is a deep attack on civil liberties throughout our country, and we are here to defend the civil liberties of our people. That is our primary duty. People in West Lindsey are obviously aggravated, upset that they're now in Tier 3 when they're right on the national average. Other areas of Lincolnshire have a far lower infection rate. As I said to the Prime Minister, Market Rasen, where I live, only has 6 per week, where Newham has 40. So clearly there are injustices. There's no doubt about that. We all accept it. But I've got that commitment today from the Prime Minister that he wants to look at a more granular approach. With other Lincolnshire MPs, I went to see the Health Secretary yesterday. He's written to me just now. He says, I understand the force of your arguments and know that you made them in the best interest of your constituents, as you always have done. As I made clear in our meeting, we will formally review the data and tier allocations for all areas across England on the 16th of December. So what am I to do? The fact is that this virus doesn't care whether this area is represented by a Labour or a Conservative MP, doesn't care how we vote. All it knows is it attacks people, particularly the frail and the elderly, when they congregate together. Those who want to vote against the government, and I am a libertarian to the core, I hate with absolute passion what is happening in our country, but those who want to vote against the government have to have an alternative plan. And I put this question to the Leader of the Opposition. He cannot answer it, although I suspect that his alternative plan is a complete and total lockdown, which we had in April, every school closed. That is the only way in which we are going to defeat this virus entirely. So we have a compromise. It's not ideal. My personal philosophy is human dignity. Every time I vote in this place, it's on the issues of right to life, whether it's abortion or euthanasia or the unnecessary wars. How can I vote against this measure tonight when there is no alternative plan, when the result of my vote tonight is that frail and vulnerable people will die? That would be the effect. And although it is with deep reluctance Although I am a libertarian, although I recognise that West Lindsey has been put in tier 3, having been given that commitment by the Prime Minister, I will vote reluctantly for the government tonight.
Steve Baker.
Thank you, Mr. Deputy Speaker. This is a dangerous moment in the life of our country. People feel they have been pushed too far, pushed about too much, pushed too hard. They've suffered too much. We think, of course, first of the coronavirus patients who've died and their families and their friends, the NHS staff who've cared for them, all the mental health issues they have suffered. We can think of the non-COVID patients who've been squeezed out of hospital by coronavirus, and let that be understood, by coronavirus, not by lockdown. Businesses who've lost custom because of coronavirus, not by lockdown. But also patients who didn't attend hospital because they were afraid to do so. Businesses who were positively shut down by the government, alcohol and drug misuse, reduced physical activity, malnutrition, self-harm, domestic violence, suicide, preventing dating. Anyone talk to somebody in their 20s and 30s who's single and feels they've been missing out on one of the best years of their life. Quantifying these well-being issues is the, I'm afraid, dreary task of health economics. People like me have not just been looking for economic analysis. We've been looking for serious analysis of these harms and benefits from the government's policies in the context of coronavirus, so that we could see seriously that, bearing in mind all of the factors at work, the government's policy in context was the right way forward. The government's analysis should have compared, let's say, the John Snow Declaration with its lockdown, where the government is, the Great Barrington Declaration, and a plan that lies between the government and Great Barrington, which I provided to government. The point would have been to show proportionality, to show the effects, the achievements that would come, the benefits, and to allow serious judgments. I've got the analysis of a QC provided to me, and he says that this analysis of the government doesn't allow the test of proportionality to be answered. It leaves us then with a problem, because the government's asking us to vote on these measures, not knowing whether they're proportional. And when I look at some of the models which were provided to us, this death projection, government scientists presented it to us and then wouldn't stand over these figures, and it turns out they were right not to do so. This hospital could... I will give way to him.
Apologies for the interruption, but I saw the so-called impact assessment, and I have to say it wouldn't pass through the border of a small business. It really wasn't up to it. Does he share my view?
I do agree with him, and he's well qualified to say. But I want to say this hospital capacity projection from SPI-M medium-term modelling, I understand, which was leaked, says it takes 3 weeks for non-pharmaceutical interventions to have any impact on hospital admissions. Therefore, the window to act is now in bold and underlined. But the trouble is, if you draw a vertical line on it through 21 days after the 5th of November, you find that 3 hospital trusts should have been exceeding surge capacity, including the Nightingales, and it just didn't happen. So we need to now start having serious looks at modelling. Of course, I've provided a paper to the government on how to reform modelling. We also need to have a serious look at how we deal with expert advice. In this complex contested field, I've provided a paper to the government on how to do it. I happen to believe that we need a new Public Health Act, one which can allow us better to balance the absolute need to infringe people's civil liberties, balance that with people's fears that they're being infringed too much, again to show proportionality. And again, I've reached out to a judicial expert in the field, and he provided us with a one-pager, which I've given to government, on what should be done. I've also, by working with independent scientists, come up with that more liberal plan that stands between where the government is and moving in the direction, it has to be said, towards a freer system. Again, provided to the government. No one can say that I or anyone working with me have not done our duty, but here we stand in a profoundly dangerous moment, heading into infringements on our liberties around vaccination and testing, which we would never normally tolerate. And so therefore I find, with huge reluctance, I'm going to have to vote no tonight to send a message to the government.
Go.
Thank you, Mr. Deputy Speaker. In this pandemic, the government has always been behind the curve, too slow to take the necessary decisions, too slow into lockdowns, not making the right decisions in a timely way, which has led to this terrible double whammy of one of the highest per capita death rates in the world and the largest recession in Europe. there seems to be no forward-looking strategy to get ahead of the virus and the kind of issues that we know from the modelling are going to come up, and there's been inadequate support of those who need to be supported. Instead, we've had vainglorious announcements about moonshots and world-beating systems, and then a failure to deliver on that kind of boosterist language. So there's been hyperbole and not enough delivery. There's been a lack of trust in the rules, not least because they keep being changed. There are 8 different iterations of the furlough scheme. There's no certainty with government support because they can't stop fiddling and changing it, sometimes within weeks of announcing it. This has caused uncertainty, it's caused cynicism, and it's hard to come to the conclusion that we've got in the Prime Minister the wrong person in the wrong place at the wrong time. This government needs to lead by example, so Dominic Cummings should have been sacked immediately for ignoring the lockdown rules, and that would have avoided an awful lot of cynicism that came in the aftermath of that terrible decision. The government needs to reward good behaviour, not punish bad, so it needs to enable isolation by paying proper sick pay and supporting those who have to isolate. The £500 payments aren't adequate. They're running out in some areas of the country with no guarantee that they'll be increased, and they're barely reaching 1 in 8 of those who have to isolate. This gives people an incentive, if they can't afford to self-isolate, not to download the app, not to take the tests, and to hope it will be okay. The government needs to work with the grain of public requirements and necessities and behaviour, not against it. The government needs to tell the truth, not keep the truth from us in this assessment that we've had that's full of weasel words. And the government also needs to show moral leadership, stop setting up VIP lanes for Tory donors and their mates and spending 18 billion of public procurement on it. They need to help the 3 million excluded who don't want to hear that £200 billion has been spent on supporting the economy when they haven't seen any of it and they're in desperate need. The government needs to be honest up front, and then it will get support.
Neil O'Brien. Mr Deputy Speaker, all of us want to see only the minimum level of restrictions necessary to keep this virus under control. And all of us want to support those who are suffering real hardship because of the virus. And I welcome the extra support for the hospitality sector the PM set out today. But there's no question that we've got to keep this virus under control. So far this year, there have been nearly 80,000 excess deaths. If you read out the names of all those people one after another, it would take you more than 4 months, because this is a killer virus and it can escalate very quickly. During the second wave in Leicestershire, the numbers hospitalised by coronavirus escalated very, very quickly and remain above the level we saw even in the spring peak. But after national restrictions came in, we saw the infection rate turning around, and we're starting to see the hospitalisation rate turning around too. The measures we took came just in time to allow life and death services like cancer treatment to keep operating throughout the time that we've gone through the peak. If we'd waited or done nothing, then doctors at our local hospitals are clear with me that those life and death services would have shut. So we took action just in time. All developed countries have taken unprecedented measures to try and control the virus, and I'm glad that we're taking action earlier in our second wave than our neighbours in France. I'm also glad that we've secured more access to vaccine shots than many of our neighbours, which will help us get back to normal faster next year. And things will get better next year. But with the vaccine so close now, people dying unnecessarily in the last days of this pandemic would be truly tragic. It seems to me that a tiered approach is the right one when we've got the virus under control, to make restrictions proportionate to the problem locally. And again, there's a contrast with France, where they've simply shut all restaurants until next year and all bars are shut with no date to reopen. Some in this debate have supported making the areas more granular as we go through the reviews. I support that, and I want to see more rapid testing in my area to drive down the virus faster. But now that we are making progress, both nationally and locally, it would be tragic to throw that away. And what's happening in Wales, where infections are now rising again, is a warning about loosening up too quickly. There are many myths circulating at the moment. COVID is not just flu, it's not just displacing flu. It's not the case, as some honourable members have claimed, that 90% of tests are false positives. In fact, the number is microscopic. And nor is it the case that those who would have died would have done so anyway. In fact, a study by academics at Glasgow University suggested on average the victims had 10 years left to live, and that is a lot. The relationship between protecting lives and helping the economy is not a simple trade-off. We can see that countries like Sweden that had a more liberal approach had both a worse hit to their economy and a worse public health outcome, with more than 10 times the death rate of their near neighbours, and yet we still seeing people online advocating that as a good way to go. Arguably, the best policy to control the virus is also the best policy to protect the economy. This has been a very, very tough year, but things will get better next year. And until then, we have to protect people's health, we have to protect lives, and so I'm supporting the measures we're taking tonight.
Alex Cunningham.
Thank you, Mr Deputy Speaker. Thanks for the hard work and dedication of everyone who lives in my constituencies. We've been able to bring down the number of cases by a half in the last couple of weeks. But despite these huge decreases, Tory failure to take the right action as far back as March meant it was inevitable that our area would end up in Tier 3 when we exited the lockdown. The number of cases in Stockton is now nearly double the national average, and we're a long way from where we need to be. In a COVID briefing last week, a health minister who was clearly trying to be honest and open said it was unlikely that our area would be brought into Tier 2 even after the 2-week review. I don't know what the Prime Minister's view is on that, but he must know that these tiered restrictions will be with us for a while longer. A glance at my inbox this morning revealed a multitude of emails, people wanting to visit their granny in a care home, the desperation of businesses crying out for clarity and proper financial support, and the devastating impact on young hockey players' mental health who want their ice rink to reopen. There's an email from a small family-run pub who have been serving our community since 1981, worried they won't make it through the winter, even if we did enter Tier 2, because they don't serve food. The Prime Minister's £1,000, as he claimed, doesn't recognise how hard they've been hit, particularly when the average weekly profit of a wet pub in a rural area is twice that figure, and in an urban area is more than 5 times that. Or what about the letter from the mother sick with worry for her daughter who, when she became self-employed, set up a limited company on the advice of her accountant and is now excluded from accessing support from the Self-Employed Income Support Scheme? Hundreds of thousands of people in the same position have been demanding action since March, and still nothing. These gaps in support are stark, and there are many more that have been pointing out across this House today, but they've been pointed out to the government for many, many months, and yet they still refuse to take action to close those gaps. Across the Tees Valley, we have already lost 12,565 extra jobs since the start of the pandemic, and the government's failure to provide full and sustained financial support to businesses in Tier 3 will surely mean more good jobs in our community will be consigned to the scrap heap. Once again, this Tory government has failed to put in sufficient protection and support for both businesses. For every job that's been announced locally over the last 3 years, we have lost 5 in the last 6 months. So we've got to look to the hospitality sector in particular and the people who find themselves out of work and give them the support they need. The government have failed my constituents at every turn in this pandemic, and sadly, the handling of support for those in Tier 3 is just another failure to add to our tally.
Will Ragg.
Thank you, Mr Deputy Speaker. And before I make my brief remarks, I'm reminded of the quote by Teddy Roosevelt, who spoke of the person in the arena, and I rather feel that my humble friend, the Minister, is that person at the moment, whilst everybody else around her carps on without any particular responsibility. And my apologies to her on a personal level if I now fall in to that particular category. But many people have been in touch with me, as I'm sure they've been in touch with us all, advancing all kinds of wild conspiracy theories that seem to abound about COVID. And I will have no truck with them whatsoever. There's been an outbreak of armchair epidemiologists for sure in the last 8 months or so. There's no conspiracy. In my brief experience of it, the British state has never been competent enough to mount or organise such a conspiracy. And indeed, if it were so, in the present climate, plans for that would have leaked already. So we would be well aware of that particular issue. Now, we are told that non-essential retail can we reopen. Before I talk about non-essential retail, I'll give way to my honourable friend.
I just think this is a very important point, amusing as it is, that for those of us who have seen behind the curtain know that he's right, not just about the British state, but about every state. They don't have the competence or capability to run a conspiracy.
Absolutely right. Shall I go back? Non-essential retail is to reopen, hurrah. But I'm not quite sure why we would express great surprise this lead. I'll give way again very generously.
I'm grateful to Honourable Jing for giving way. You're making light of some of this, which is amusing. There is a dangerous agenda behind some of these conspiracy theories. There's a lady quoted in the Mail yesterday who, when you go on her Facebook feed, is celebrating the burning down of Jewish-owned banks, right? And she's presented as someone who we should be listening to on public health. Do you think that's right?
Absolutely enough. That was brought right the number of lunatics in this country, quite frankly. I'll say that to my honourable friend. Now, non-essential retail is to reopen. Why on earth was it closed in the first place? The Secretary of State beams at us from the pages of the Daily Telegraph yesterday to say, rejoice, you can go out and shop around the clock. And we expressed surprise that so many of our high street retailers are going to administration. And I wasn't particularly aware that the closed rail at Dorothy Perkins was ever a particular vector of disease. And so this all links into the proportionality of the measures that are proposed. Now, to leave aside my levity in opening, I have to say that I always believed that the Civil Contingencies Act would be a far better vehicle for measures to be implemented. We talked about this huge statutory instrument before us this evening and say that some of us are going to withhold or indeed vote against on the basis that we wish we were able to amend it. Well, you could amend it if it was done under the Civil Contingencies Act. Perhaps that's the reason why it wasn't used. And the Civil Contingencies Act, of course, contains within it a 30-day review period as opposed to a 6-month period under the Coronavirus Act. And I think that the government has nothing to fear from greater scrutiny. Greater scrutiny leads to better government, and it should be accepted as it is proposed. Now, to come on to parochial matters in my own constituency and tiering decisions, to sound like a broken record from what we've heard this afternoon so far, and I contend quite strongly that Stockport should not be re-entering Tier 3 as it was before the lockdown. It should perhaps more charitably be placed into Tier 2 because its levels of COVID per 100,000 of population are now below that of Cheshire to its south, and that was put into Tier 2 last week. Now, briefly, I am concerned about decision-making. I am concerned about the so-called Gold Committee, and if one reads what one reads in the Sunday Times and believes it, which is sometimes a leap of faith in itself, but on this occasion I'm minded to believe it. And the talk that the decision over tiering for London was on the basis of 50,000 jobs being under threat if it was placed into Tier 2, as opposed to 500,000 if it was placed into Tier 3. My constituents deserve exactly that consideration as well. I do not believe entirely in this north-south divide, if that's a conspiracy theory that abounds in this House. But when we have decisions such as that, one cannot but help wonder if it may be true. Briefly, PACAC, of which I have the pleasure of chairing, wrote to the Chancellor of the Duchy of Lancaster last week to ask for further evidence on the 5 tests. My concern is that the 5th of those tests, that is to say pressure on the NHS, including current and projected occupancy, will trump all other considerations. But the data and the information on that is not freely available, and no answer has of yet been received to that letter. Now, if these measures are arbitrary and there's no exact science behind them, then I'd sooner that the government would admit that, because at least it would be an honest approach. But as it has not done so, I cannot support these measures this evening.
Mary Kelly-Foy.
Thank you, Mr Deputy Speaker. My constituency has been placed into Tier 3 restrictions along with the rest of the North East. And while I was disappointed by this decision, I can accept the need for these measures in order to protect public health. However, what I cannot accept is the lack of support from government, the regional inequality on the restrictions and the complete lack of an exit plan. The current support offered to businesses is simply nowhere near enough to protect our local economies. £20 a head in business support for the duration of Tier 3 will be of little comfort to businesses in the North East who have been under increased measures for longer than most areas. Without genuine support, businesses will go under, jobs will be lost and people will be pushed further into poverty. While COVID-19 is a great threat to public health, there's no greater cause of illness than poverty. To place the North East in Tier 3 without genuine support for workers and businesses is to condemn thousands to poorer health and worse life chances. To support this would be to abandon my responsibility to my constituents. Added to this, the government have repeatedly refused to properly fund local contract tracing, which is far more successful and cost-effective than the government's shambolic centralised system, which has mainly served to help line the pockets of government's friends in the city. Without a functioning test and trace system, a cycle of lockdowns is inevitable until a vaccine can be properly rolled out. The government have had 8 months to sort this and they've failed. They desperately need to step up. Mr Deputy Speaker, this government advocates for a regionalised approach to COVID-19 restrictions, yet also insists on dictating these restrictions to local authorities, ignoring their advice on contact tracing and withholding the necessary funding. If the Prime Minister wants a regionalised system, then he needs to actually support our regions. And finally, what my constituents want to know is how we reach Tier 2. Local authorities need to know what the infection targets are and how the government will support them in bringing them down. Currently, it's as clear as mud. Unfortunately, as the government doesn't have a plan B, members must choose between inadequate restrictions and no restrictions at all. These measures will hurt our communities, yet we also know the damage this virus will cause unchecked. In their current state, these restrictions would deeply be damaging to Durham, and the financial support just isn't there to mitigate this. So if the Prime Minister wanted Labour to vote for these measures, he should have presented something that we could actually vote for. It's not the job of the opposition to vote for bad legislation or to pass the government's business. I urge the government to give businesses and workers the support they desperately need to fix track and trace and to start treating the North fairly.
Greg McKinley.
Mr Deputy Speaker, I think it's rather apposite that we're having this debate this afternoon on World AIDS Day, and many people are wearing the symbol of that. Now, consider backwards in the 1980s when AIDS was the pandemic and the risks were very much there. What did we do? We actually told people to change their behaviours. We had very strict messaging, but we didn't take away liberties. We didn't fine people. We didn't close down the pubs, whereby it was obviously a place where future infection may start. Now, I debate today with my constituency, or part of it. The Thanet local council has a very high level, 448 per 100,000. That's really in the top 5 in the country. And I understand that the government is having to make some tough decisions, trying to get that time, that bridge to the vaccine. But we need some honesty about how rapidly that vaccine will come. We've got the Telegraph is chirruping away that it's coming, but it's not yet quite in sight. We're waiting for MHRA to approve those vaccines, and it will be a large logistical exercise to roll out 66 million vaccines times 2 over a period of time, where the NHS currently, in every year, does manage to roll out 15 million seasonal flu vaccines over 4 months. So this is going to be a major undertaking that will take time. And I think the government needs to lay out very honestly that we will need to be living with this virus for some time to come. But great credit to the government that we've got a massive amount of testing. Great credit that we're having very regional, granular data as to the level of infection per 100,000. And that, I think, is the most powerful tool that the government has. I think that is the driver of good behaviour. When people see that their infection levels are higher, people just innately do something more sensible. But we are subject to short-termism. We're subject to the precautionary principle, I think, has infested our lives perhaps too much. We have to ask, what about personal liberties? We haven't heard that much about that this afternoon. I had a particular email which touched me just yesterday. A chap sent a photo of his father in September in an old people's home, just frail, not unwell, but frail. He looked bright and well. He had that sparkle in his eye still. He sent me a photo just yesterday. Nothing wrong with the man, nothing's changed, no more health conditions. he looked broken. This is the worry. We are breaking older people where there is nothing left to live for. Are we properly assessing all those health outcomes? Now, obviously, we want to put more money towards those in hospitality, but surely better to get them COVID ready so we can open up again. They don't want this money. But for the benefit of doubt, it is easy to give the government. They need to be a higher level than that. And tonight I can't support them.
Mike Gainsbury.
Thank you, Mr Deputy Speaker. Yesterday I received an email from Alison, who runs the Bears Paw pub in the Frutcham part of my Weaver Vale constituency, the town that I live in. And this historical pub is at the heart of the community. The family and staff work hard. It's got great food, a good atmosphere in usual times, very good beer. It's a great place to go and watch the football. Like many pubs in my constituency, they've introduced every COVID-secure measure under the sun to keep customers, the staff and, very importantly, the community safe. They've sacrificed so much for the greater good, given and supported local food banks, school children when they needed support in regards to school lunches. Collectively, Mr Deputy Speaker, they've done their bit to help curtail the spread of the virus, with infections and, thankfully, death rates now coming down in the Cheshire area. I think I've looked at the figures today. It's Cheshire West and Chester, it's 100 per 100,000. I think my honourable member for Hazel Grove over the way referred to Stockport. I think that's at 155 to 100,000. Again, progress right across the patch. As somebody that literally grew up in a pub, I know how much the Christmas trade means to pubs, and very importantly, it's been mentioned across the chamber, the supply chain, such as breweries. I've got Chapter Brewery right on the edge of my constituency. Now, I've lost touch with how many variations of business support packages that have been shaped so far, always at the last minute, which makes life and business planning incredibly difficult in our communities up and down the country. If our hospitality sector is to survive, and small breweries such as Chapter on the edge of the constituency, they need more support in Tier 2 and Tier 3 areas. Scotch eggs, plates of chips and £32.50 a day will not save the day, save the week or that lost year. So I, along with people on the opposition benches and more, cannot support the measures put before the House today. A position I would hope that will act as a clarion call from constituencies from right across the land. We need more targeted support in our communities, and we certainly need, and keep asking for this, local test and trace facilities in our local authorities to get things working and quickly. Thank you.
Stephen Hammond.
Thank you, Mr Deputy Speaker. It's a great privilege to speak in this debate and to follow the honourable gentleman, because what actually this shows for many people in the House tonight is what a challenging, difficult decision we have to make. I've listened to many of the contributions, and many have portrayed the contribution as a challenge between lives and livelihoods. But as constituency MPs, we all know that behind that there are stories of personal tragedy, sadness, death, and the same in livelihoods, stories where people have struggled to keep businesses running and jobs have been lost. And so it is a challenging decision that we face this evening. I listened to my honourable friend for Dorset East, who said a few moments ago that, and particularly when you get to 50th Speaker in the House, much of what you will say has already been said. And so I apologise to friends and colleagues that some of the things I should say have already been said already. I said to the Secretary of State the last time we debated this that I hope that the time we used, if we gave the government the chance to put those national restrictions in place, would be used wisely. And I have to say there have been some real impressive successes, and I think the same applies tonight. that if tonight I use my vote to ensure that the government can put these tier restrictions in place, my ask of the government is that it treats us as colleagues and makes progress during that period. And has been reiterated several times. 3 key asks I have. 1, trust us with the data. Yesterday, a document was produced. It was cut and paste, and on paragraph 320 of the economic impact, it said it's not possible to know with any degree of certainty about forecasts. And yet we learned this morning from a leak that there is a document with better forecasts in. So I ask my honourable friend on the front bench tonight, will she give the guarantee to this House, or who winds up, that we will be able to see that data so that in future we can make those more informed decisions? Can I also say to my honourable friend, like my right honourable friend for Epsom said, we need sensible decisions. I feel a little bit like a pariah being a London member in the House, being told that there's regional inequalities and London is getting the benefit of all of it. I can tell you as a London MP, most of my constituents do not think that the decisions being made on tiering reflect either the economic or the health realities in their borough. And I ask yet again that the Minister take back to the Prime Minister that we want to see these decisions being made on a borough by borough and a more localised basis, because the mass testing will now allow that. And finally, so that we don't have the Christmas docudrama of the case of the Scotch egg, can we ensure that the hospitality industry is not governed by behavioural scientists and governed by reality, because we want them to be there to enjoy that drink when vaccine kicks in next year.
Liz Twist.
Thank you, Mr Deputy Speaker. In the North East, we've been under restrictions prior to the national lockdown for some time, particularly in the area Northumberland, Durham and Tyne and Wear. We've been tackling this in a proactive way, with local authority leaders coming together to see that we reduce the rate of infections, and we were plateauing before lockdown. But it's been hard, Mr Deputy Speaker, hard for constituents not able to meet family and friends, see their relatives in residential care, hard for businesses who have seen their trade or business reduced, hard for those excluded from support through job retention schemes or self-employed support schemes, those who have been excluded from that help and who are facing dire straits. And nothing that I will say today will be a surprise, as I've been banging on about this for the last couple of months at every possible opportunity. But just to go over it again, we need effective local test and trace. We needed it weeks ago. We need it still. It could have helped us to reduce the spread of COVID-19 so much more effectively and get out sooner. We need really effective support for those who may have to isolate but don't qualify for the £500 isolation payment, or indeed any other payment, any sick pay. It's absolutely essential to stopping the spread of COVID-19, and we have to give realistic support to our local businesses, already hit so much more than in many other regions. It's their busiest time of year, and they are not able to trade. The money announced today, they tell me, doesn't go near addressing their losses at what would be the busiest time of year. So I ask the government to look yet again at that support and help those businesses. Mr Deputy Speaker, COVID-19 hits those communities hardest who already suffer from health inequalities. Communities like those in the North East, those in my constituency, and we've been hit hard by this virus and hit hard by the lockdown, and the impact on our local communities has been severe, and those concerns must be addressed. And we have to learn that we must restore the funding to public health services to make sure that this doesn't happen again and that public health is able to respond effectively. My constituents and those across the North East deserve no less. Now, a lot of my constituents are asking questions about why London is in Tier 2 and we're in Tier 3. And they perceive that they are being treated differently. So it's really important that the government undertakes to review these figures weekly rather than every 2 weeks.
Lucy Allen.
Thank you, Mr Deputy Speaker. And I want to start by thanking the Prime Minister for steadfastly battling to get us through this crisis. Anyone in his position would have no option but to take the measures he is proposing today, and he has my support. Now, each and every one of us in this place cares passionately about the lives and livelihoods of our constituents. And in a liberal democracy such as ours, it is right for MPs to challenge accepted narratives, explore alternative perspectives, examine the facts and seek to form an opinion. In so doing, we are serving our country and our constituents, and I pay tribute to the Honourable Member for Wickham. It is our right and our duty to engage in critical thought and to come to different conclusions and then feel free to speak in this place. Now, throughout lockdown, it has been a repeated assertion that those who question the science, that those who refer to the terrible costs of lockdown and its impact on our communities, well, they just want to let the virus rip, kill granny, prioritise profit. Whereas those who want the hardest possible lockdown, they're the good, responsible people who care about lives. This has become a divisive narrative which is inhibiting proper debate. We must be free to take different perspectives, and we must not demean those who do. It is incumbent upon all of us to ensure that this place is a bastion of free speech, and whatever other freedoms COVID has taken from us, we should not let it take that. Now, the state has sought to control the minutiae of our daily lives with the arbitrary, the capricious, the prescriptive, and whether we can eat chips with beer or who should cook the turkey at Christmas. The more arbitrary the rules, the more inured people become to rule breaking. And when it comes to the really important rules, like isolating when you get a positive test, well, these rules too become much easier to break. If the Prime Minister was not such a libertarian, if he were not the freedom-loving man I know him to be, I too would find it very hard to support these measures this evening. But I firmly believe that anyone in the Prime Minister's shoes would have no option but to bring forward these proposals. I would just caution the Minister, who I have huge admiration for, please can we show some humility? We're not going to be getting everything right. We are doing our best. We are doing everything we can to get the country through this time. Our constituents understand that, and it does not diminish our standing to show some humility. It shows our humanity, and I should be grateful to her if she would take that back to her department. This is a new science, and we don't have all the answers.
Tammy.
Thank you, Mr. Deputy Speaker. My city, Coventry, has made enormous sacrifices as this invisible disease has turned our entire world upside down. And I would just like to pay tribute for all those who have loved loved ones during this difficult time. Mr. Deputy Speaker, since the beginning of this pandemic, I have persistently reminded this government of the Chancellor's promise in March, and he said whatever it takes to support people out of the crisis. Instead, last week, the government exacerbated the economic crisis in communities like mine by putting Coventry in Tier 3 and announcing a spending review that felt unacceptably short. Key workers will have their pay frozen, cuts to universal credit, our NHS, police and schools completely underfunded, no real plans for jobs and no plans to upgrade skills, and hard-working people hammered by council tax bombshell handed down by the government. Mr. Deputy Speaker, I have been contacted by countless small businesses and self-employed people understandably heartbroken by this government's decision, including pub owner Libby Payne, whose own pub, the Old Clarence in my constituency, has felt the weight of the lockdown. She has always operated in COVID-safe ways within the guidelines, and she has never had a customer question her practices. She describes her business as a customer's living room. And many other constituents unfortunately now live alone, in isolation, unable to see the people that they class as family. Libby has had 0 cases linked to her business, yet she feels penalised, all because her postcode is in Coventry and not in London. This is exactly what's happening to our pubs up and down the country, which we all regard as the hearts of all our communities. Mr Deputy Speaker, I cannot in good conscience actively support a tier system that, although intended to protect my community and protect lives, deprives my constituents the chance to see loved ones in the run-up to Christmas, adversely impacts my constituents' mental and physical health, and cripples my local economy, and starves the livelihoods of both men and women who have done nothing but the right thing since the beginning of the pandemic. They have had their sacrifices routinely overlooked by the government. Now, all these measures are due to pass today, and I urge the government to review the allocation of the tier system on a sub-regional level, and I'm glad the Prime Minister said that it's something that he's considering, but waiting to February is a rather long time. In the meantime, I would ask the government to implement a mass lateral flow testing, provide us with the support our public services need, financial support our business and my constituents need, and reverse the council tax bombshell on my very hard-working residents. Thank you, Mr Deputy Speaker.
Edward Timpson.
Thank you very much, Mr Deputy Speaker. When I spoke in the debate on the 5th of November to determine the lockdown we're about to emerge from, I said that we needed a plan for how we can live with the COVID-19 virus in the longer term and keep the R rate below 1 once we have reduced it, so that we can continue to reopen the economy and, most of all, give Eddersby residents and businesses the normality, certainty and hope they crave. Now, the good news is since then we have got R below 1 and there is real hope in the form of viable vaccines homing into view. However, as the Prime Minister often and rightly reminds us, we aren't there yet. Nobody is. And so that plan is still needed. And to that end, when looking at any realistic alternatives that are likely, in my view, to lead to intermittent lockdowns, there is logic to a tiered approach that best reflects the most effective restrictions for each particular tier. The question is, however, whether we are confident that the measures proposed and the geography and proportion in which they pertain are indeed the most effective. This includes looking carefully, consistently and at times courageously at the evidence for and impact of measures placed on specific parts of the economy, not least, as virtually every member who has spoken has highlighted, the hospitality sector. Pubs, restaurants, hotels and, as I've raised on numerous occasions with ministers and in this House, the £10 billion plus wedding industry, where, irrespective of tier, it remains restricted to just 15 people at its venues, despite equivalent indoor events and business conferences now being able to operate at 50% capacity or up to 1,000 in Tier 2 or 2,000 in Tier 1. This is decimating what was and can still be, with the right approach by government, a thriving and growing sector. Northern Ireland has shown that socially distanced weddings and receptions are not virus spreaders. So please, 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 can ministers enable weddings in Cheshire and across the country to operate to socially distanced capacities before it's too late? With lockdown ending, the House has to make a decision this evening on the measures now needed to control the virus while enabling as much normality as possible. And whilst recognising the often invidious conundrums facing us, I'm not sure in all circumstances that balance is yet right, and I do have real sympathy for those living with some of the apparent anomalies that exist. But this continues to be a public health emergency, so I will support these regulations, albeit with a similar ask from colleagues that we work together to find the best and most effective path to prosperity.